And only on 7 News, the children you see here can't eat, breathe, or function on their own. Yet, the government funding to pay their nurses was suddenly cut off, forcing their caregivers to make some tough choices. 7 News reporter Marc Stewart is live and asking the state tonight how this could happen. Mark?
And the question is this: did a government policy that's meant to protect taxpayers put the health of innocent children at risk?
And he's got a shunt.
The children here have been abandoned.
Okay.
Very few people know how to care for them.
Yes.
Even fewer want to offer help.
Most of the time, these children would not survive.
Attached to life support, nurse Donna Everly calls these kids high-tech children. She's even adopted 3 of them, now living in her home health care facility outside of Colorado Springs.
It's my vocation. It's my want to make a change in this world for these children.
Medicaid pays the nurses who provide 24/7 care, but some questionable bookkeeping has now made Donna the target of a fraud investigation.
Do I acknowledge that I made some choices that probably I shouldn't have? Yes, I do. Desperate times, desperate measures.
Federal law mandates funds are cut off immediately if there's a fraud investigation. That means no money to pay specialized nurses.
Are you being paid right now?
No, I am not.
For 2 weeks, the nurses here, including Michelle Schrum, worked without pay.
If they don't have somebody to care for them, they're in danger.
And finding another agency to come in and provide this particular care is difficult.
Was a caseworker who alerted you of these concerns?
Actually, I believe we heard it from you.
After questions from 7 News, El Paso County and the state have agreed in the short term to pay the nurses. But the larger question is this: should Medicaid funds be cut off in all fraud investigations without a closer review to make sure patients, in this case kids, aren't hurt?
Do you think that the state and the government should have handled this differently?
Absolutely. I am very angry at many people for not coming to help with these kids.
The Department of Health Policy and Financing would not do an interview with us, citing privacy concerns. And this Medicaid policy, this procedure, has been in place since 1987.
All right, Mark, thank you. And Donna Everly, by the way, says she reached out to the state for assistance, but she felt the alternatives would not provide the same level of care in the time she needed it.